I've actually been doing a lot of research since I started this channel, because I'll tell you what, I have a lot of experience from my own experience and from talking to a lot of people. And I'm talking, people that have had home births, that have had birth center births, that have had hospital births, medical staff. I've talked to a lot of people over the years, and I've learned a lot of things just experience wise from all these people. But I'm not a statistic person. I'm not one that can statistically sit down and give you all the numbers and figures and all that. I'm not that person. I'll tell you other stuff that I know, but I'm not that. So I've been kind of looking into that, because there's a lot of people doing all this stuff with exactly like these minimal skill of looking at like one birth center and being like, look, it's amazing, America. But it's like, America's really big, and that doesn't make any sense. So I've been kind of looking at a lot of these different things. And one of the things that I've seen, even for my own state lacks medical care, lacks care for labor and delivery. One of the things that has been brought up by not just doctors, but even like people of like different states in my state and community, and like just a lot of people have been bringing this up. We do not have enough doctors. We do not have enough nurses. We are having so many people go in to have babies, but we do not nearly have enough people to cover all those babies. You're talking how minuscule like it is of the numbers of doctors and staff compared to how many people are actually having babies. And that's just that department, let alone there's a lot of other departments in a hospital. So just to know that we don't have enough. And I do know that there was so many years ago, there was a big increase of like more women doctors, more women's becoming gynecologists and OBs, because before it was more of a man's field being a doctor. And that's great. But I'm hearing a lot more women that were going for doctor stuff and getting in and saying, oh, I'm just going to be a nurse because being a doctor is so stressful. And I also know a lot of people that have gotten to stuff and they're like, it's so much responsibility. It's so stressful of the stuff and the things that they see, the things that they deal with, just like these train wrecks that come in, all this stuff. This is a lot. And this is a person choosing a career or lifestyle that literally you don't think of it about it. But an OB has an office that they're at 5 days a week. Maybe they have a half day one of those days, but they spend at least one day where they're at a hospital on call. They're constantly leaving and going and delivering babies all night, all weekend, all the time. They leave their own vacations. They do all these things just to try to, be there to deliver babies and take care of babies and make sure everybody's okay. So if you think about all that, like this career stuff isn't like a normal career where you go and like check in, like you clock in, you clock out. This is an ongoing life thing. They literally have their phone on them all the time. They're sitting with their family. How are you doing? They just had some kids and they're literally like, oh, I gotta go. There's a baby, right? One of my ladies having a baby. She runs off to the hospital and leaves her kids. This is constantly happening all the time, but yet somehow we have this like view of how bad medical people are and how bad the hospital is, but they're literally giving their life to us. And we don't even think about the stuff that they have done, the things that they sacrifice, the stuff or whatever. I actually have learned from talking to doctors and nurses right here in my own city that they have like they have statistics of how many people go through that are having babies and how many times they actually make it to the birth of the baby, whether it's natural or even a C-section, because sometimes emergencies happen too, and you end up in the hospital and whoever's there is whoever's delivering your baby, which is fine. We got to do what you got to do. But I mean, how often when you're doing medical care, you're sitting in the doctor's office and you're like, man, I've been here for over an hour. And as it turns out, your doctor has left and is at the hospital next door and is delivering a baby. And then you wait about another half an hour and here's your doctor running in the back door and suddenly you're seeing your doctor. That's literally what they do. And I don't think we give them enough credit because I don't really think we look at them as like human beings, as people that are like, they're trained and they're educated and all the things that they're doing just to try to better our lives, to better us. And I think we look at these midwives and these doulas that come up and they have no experience whatsoever. They have no training whatsoever. And then they're going into the hospital with their train wreck to a doctor and telling them stuff where the doctor's like, Okay, first off, you're in a hospital facility and we have to check the mother. We have to check the baby. We have to check everybody out. And we also have to do paperwork because everything is documented and goes somebody looks over everything. We have a medical board over us. We have staff that we are telling them what's happening. There is a lot of like dotting those I's and crossing those T's that they have to do every single day. And as much as I do think, there should be this level of choice, I also think there's a way that we could do things in America with the establishment that we already have set up to make it that you want your home birth, that's fine. You go to the doctor early on and sit down with your history, and the doctor tells you, you know what? You are the perfect candidate for home birth. Or, you know what? You've had this, and this happen in your past. I don't think that you should have a home birth. I think that's dangerous. I don't think you should be at a birth center. I think that's dangerous. I think we should put you in the hospital. And guess what? I have midwives right here that are nurse midwives. They will treat you, be there for every appointment. They will be there for your birth of your baby. And this is what we should do. So we need to be more involved. Do you want to be more involved, midwives and doulas that say, hey, we want to be in with the hospital? Well, guess what? You got to put your big boy pants on and you have to have the education and training to get in the hospital. I don't get to go in and tell my doctor how I want everything done. They've spent more years probably than my life knowing stuff that I have no idea. I don't go in and be like, you put your gloves on wrong. Like, that's not how it works. Like, you washed your hands wrong. They're a medical person. I'm a person off the street. And guess what? That is what a midwife is. And that is what a doula is. They're both the same thing. Throw them in the same thing. Get the education and training, and then you can go up with the doctors and the nurses. And guess what? They'll have respect for you too, because you'll be on the same level where you can talk medical stuff to them. When a midwife comes in and says, oh, baby's having distress, well, what does that mean? Because guess what? The nurses and doctors have a code. They have a code for that where they know exactly what's going on. When a midwife comes in with what's going on, it's not really what's going on, and they have to check you out. And all that time is just wasted time. It's time that they are not just trying to cover their butts, but they're also trying to make sure that they didn't get you didn't get misdiagnosed by a midwife either. The midwife could tell them anything and they're like, oh, let's go do this. And as it turns out, by the way, you didn't need to be induced. You needed a C-section. You have to be on the same level. And until they're on the same level, they're just not. And we looked up all this stuff. Actually, we were spending this, me and Marissa were looking things up, and I'm sure Megan was looking things up too. We were looking up doula training, and we were looking up all these things. And I know a little bit about midwife training and stuff, but I didn't know anything about doulas. The book that's required to get your doula certification that you don't have to get is freaking Ina May. That's one of your books that you have to go through and do your review thing on. How can you compare yourself to even go sit in the hospital with next to a nurse or a doctor, even a resident that's already had this education? You're not there. You're not at that level. None of us get to walk in and pretend like we know medical stuff. We can watch medical shows on TV. We can watch YouTube videos about doing surgery, but your midwife's not going to go in and tell your doctor how to do your C-section. You know what I mean? The nurses aren't even telling the doctor how to do the C-section. They know what they're doing, and the nurses blend in because they're a team. So we need to have like something established in between that you want to be this outside source. You're going to have to bump up a little bit more to get to where you need to be. And that's not just for the hospital side. If they have the medical training or they have whatever, they could risk us out sooner than having the train wrecks. That's what bothers me about it, is that there's things that they see and they ignore. Now, do they ignore it for their training or education? Yes, that's a big part of it. But there's also a big part of it where they see it and they're like, you know what? We're going to do this without that medical side of stuff. I know this is bad, but I'm going to do it anyways, because they want to play this like thing of saying, hey, look, I can make a new hashtag because I didn't have them go in to get interventions. I can say, look at me. I'm the midwife that delivered that baby in a dangerous situation. So some of them do know this is dangerous and they do it anyways. And then they pass that information to the new midwives and the new doulas that they train. And it's the same old thing in a circle. They've never updated. Literally, if you talk to a midwife, they'll tell you about granny midwives. What year were granny midwives around? Could anybody even tell me when that was? Because I'm pretty sure granny midwives are not needed in 2021. They weren't needed in 2013 when I went for a home birth. So granny midwives is something that was like, yes, that was necessary for the times, but things have changed.
If you want a guesstimate for granny midwives, I would say it was about World War I. By World War II, I believe the majority of families were delivering in the hospital. So granny midwives is my great grandmother's age, and I'm older than most of you, so add another great for your generation. I mean, there are no granny midwives anymore. Ina May wasn't a granny midwife. She was kind of new age midwife, I guess. But no, the granny midwives. When was Call the Midwife? When's it set at?
The 1950s. It's
1950s.
London.
Yep, that's about when everyone was giving birth. I will give the UK credit for having the community health concept, even though I think there are some flaws in it. But yeah, there were midwives, but they also sent their clients to the hospital when it was needed. They did not shirk from that.
But on Call the Midwife, if we're going to touch on that show, even after what I've been through, because I do have an ability to separate emotional reality from entertainment. I like Call the Midwife for its entertainment value. But going back to that show, when they opened the birth house where like people could go in and get the gas for pain treatment and C-sections were being available and stuff, those midwives were happy. They were like, this is great because now we have a maternity home that we can bring our clients to, which is so different from the mentality of American midwives now, no matter what their training is. If a midwife is not exclusively working in hospitals, then they don't really want to be integrated with the hospitals in a modern American sense. I do want to touch on something that Danielle said too, where she was saying that doctors they're in their appointment, their office 5 days a week, and maybe one of those days is a half day. They're leaving their vacations, they're leaving their kids' soccer games. Like doctors are being called away from their lives and their families all the time to catch babies. But my first video I ever did with you guys was about the pieces of a woman. You can't even say that about the midwives that are providing birth care to people in the United States. How many times have we heard of a midwife-assisted home birth where the midwife couldn't leave her grocery shopping errands, wouldn't leave her daughter's dance recital, wouldn't leave this situation, couldn't leave a different birth? And it really just kind of like they're giving you all these reasons why doctors are terrible. But if you peel back what they're saying, they're just giving you examples of why you shouldn't trust them. Because, I mean, just a couple weeks ago, my midwife posted something about precipitous labor, and this happens all the time in my practice. People are birthing their babies before they can get there all the time with my practice. And it was this long post about what to do if your baby comes out before the midwife gets there. There is not a single doctor out there that is providing mothers or birth-giving parents with information about what to do in case your baby pops out of you before the doctor can get there. Your doctor is saying, once you are in labor, get into contact with me so we can make sure you're in the hospital, because if I can't get there, there's 10 other OBs who will catch your baby safely, and there are nurses who will be overseeing it. There is no profession out there that actively teaches you what to do in case you don't actually need them, except midwives. Like,
can I ask you a question?
Yeah.
I want to ask you a question because of that. Were you told about Bradley method?
No, I was adamant. There's a lot of things in my care where I was like, I'm a VBAC. I'm not gonna do certain things. If this baby is not coming out of me without weird shit going on. We got to go to a hospital and have a C-section. I didn't know. Part of the reason that I know that they were hyper aware of the complications of my labor without informing me of them is they were having me do spinning babies moves while I was in labor. And at one point they had me with my feet. Oh, I'm not going to talk about the details because this will be involved in court. But they were having me do certain spinning babies moves. And I remember I stopped at one point and I was like, excuse me, but this is insane. Why do you have me doing this? Because they were having me move into positions that weren't safe for me. Like, physically unsafe for a human to contort their body in this way. And I was like, is there something wrong here? Because this isn't normal. This is not what you guys told me my birth here was going to look like. And they never admitted to me what was going on, and they never admitted to me that he was out of position. But then looking back on it, I went back, and once my doula is about as smart as a doula can be, if you get what I mean. And she is somebody that if you go at her aggressively at all, she crumbles. And she has accidentally admitted to me several things about my labor that I had not been made aware of because I've gone at her and been like, what the hell is this all about? And two of the things that she accidentally admitted to me after my son died, that were complications they knew of the whole time I was in labor. I went back and I referenced those things on the Spinning Babies website, and I figured out the whole time I was in labor, they were trying to Spinning Babies all of those complications away. They wouldn't have told me about Bradley method or anything because, like you said, they judge the person. They read who you are and what you want. And if it wasn't something that a doctor would do in a hospital and try to get babies out, I wouldn't have been about it.
See, we got told about the Bradley method. And we were told, like, get this book. And I think she actually might have even gave us the Bradley method book to my husband and stuff like that. And and it's in the community, you get around other couples and like guys are like, it's so cool. I caught my baby and, and all this stuff. And the guys kind of like, yeah, like together, like it's this big like dad moment or something to be part of the birth or whatever. So they make it like it's this really awesome experience, which it is. But at the same time, what I learned years later was the reason they pushed the Bradley method on home birthers, like maybe not so much on birth center birthers. That's why I was curious if you had even got this push on you. But I think they pushed the home birthers, the Bradley method. So when you make that phone call, like, oh, we're in labor, and the midwife doesn't show up, it's fine because the dad's going to just catch it, or a friend or your mom or somebody's going to catch your baby without the midwife even being there. So I think it was just like this way of like setting you up to be alone, like all from like the beginning appointments is really what I think, because majority of the people that I know that have had home births here and all over the United States and even in other countries, believe it or not just America, but we're talking Canada and Australia and overseas. So this is more than just America. I can tell you they've called their midwife, let them know, and she'll say, oh, you're at 4 minutes. Let me know when you're at 3 minutes. And then they'll be like, okay, she's at 3 minutes. Okay, now let me know when you're at 2 minutes. And it's just because they don't even want to get there. And by the time they do get there, they either get there right at the moment that it's happening, or they get there afterwards. And then they're the big hero of the story, even though they weren't there. So you have all these months of prepping of them being like, we're going to be here for you and we're going to support you. And I know exactly what to do. And I'm going to be monitoring you and all this stuff. And then the moment comes down and they don't even show up. And I actually remember, I was overdue. When I hit around 40 weeks, because I thought I was going to have him early. Funny story, but my midwife had a daughter in high school and she was supposed to do her senior trip in California at Disneyland. Okay. And she was going to go as one of the people, like, you know, whatever the chaperones to whatever. So she actually told me at my appointment, well, I hope you don't go into labor this weekend because I'm going to be in Disneyland. And I'd have to drive all the way back and whatever, and made like this big deal because she was going to be in Disneyland. And yes, it was about the time, like I was probably maybe between like 40 and 41 weeks. So around this time I could have easily went into labor. And that's around the time that she introduced me to her backup midwife, who was another midwife here in town, and was like, yeah, this is her, whatever. And kind of gave my contact information and all this stuff. But yes, my midwife had it in her mind. She let me know right at the end, like, I'm probably not going to be here because I'm in Disneyland. And I was like, oh, awesome. And I was like, I really hope that doesn't happen. And then, like, you know, everything else happened later. But it's just one of those, like, I think about the Bradley method is just a way for the midwives to pretend like they're going to be there, try to get the guy all involved and excited about it. But then the reality is they just don't even show up. So you're either catching your baby yourself or someone else is catching baby. And then they come and maybe assess the situation, maybe not, because they don't really know much medical training about what's good and what's not anyway. So that's why I asked you, because I was very curious if this got pushed on you, because I know for a fact, every person that looks into home birth, that is very, very pushed on them. And they give away books or they tell you to look up online and they want you to look stories up about it. And it's all like kind of a little bit more feeding into the guy version of like him catching his child. But at the same time, like I said, I'm pretty sure it was so the midwife doesn't show up. Just like the movie, the midwife did not show up.
I would be utterly, I'll look around. I know some people who have had home births with my midwives that, or I know of some people, I know some people that had at their birth house, only a few that I've heard of who had them at home, but I can try to find out. I would be shocked though, because of my person, the exact midwife who owns the facility my son died at, because she did contribute to the Mama Natural books. So like those are like stacks of them are in her waiting room for Sal all the time. And like the only birth class that was recommended to me was either go do the birth class with your doula or do the Mama Natural online birth class, or do both of those. There was really no other recommendations from her. So her specifically, I would be shocked if that's recommended at all, but that's only because she has a vested financial interest in suggesting the Mama Natural book series.
So what's the classes with your doula? Like, what's that? What does that detail? And did you look into it, or do you know anything about that?
I went to it.
Oh, you went to it. Okay.
The only one I didn't go to was her spinning babies class because, well, she owned, we don't actually know who owns the business.
What?
Now.
Oh, somebody does.
I think I know.
Somebody writes it on, signs it around.
For the interest of my lawsuit, I will not be speaking to who we believe owns the business because it's really fricked up.
Well,
Really?
they could be in receivership, which would be unusual, but it would be one dodge.
That's what they do.
Well, I know who the business was originally registered to in 2017, but that's all going to be in my lawsuit. So the doula owned this one company and still owns it as like a prenatal massage person. And then her and another doula came together and joined forces under this one umbrella company. The umbrella company is the messiness of the ownership. But the two of them would run classes together, and it was anything from like breastfeeding basics to what to pack for the hospital. They were all like one-night classes, and you came in and you discussed things, and it was like a round table class with a bunch of other people there. And it was beyond out of their scope to teach any of these classes. They weren't even supposedly supposed to be teaching the spinning babies classes because they don't hold licensing for it. They don't hold the certification for it. And I heard, and for a short period of time, the spinning babies classes were taken off of their website this summer. And I figured out it's because her business partner that was teaching the spinning babies classes doesn't have the credentials even per spinning babies, which who knew there were credentials at all. But their classes were very much very out of the scope of practice, very out of their lane, very much, I mean, it's their expertise, if you want to call it expertise, because they've just been around a bunch of natural vaginal intervention-free childbirth, but it was all very much geared to making you feel like if you chose the hospital, you were choosing interventions automatically. You were choosing to risk out after 24 hours of labor. Like, it was very geared towards reinforcing the idea of the only place to birth and have a fulfilling birth is outside of the hospital.